Hi, this is Katie with Alpine Rescue Team. Today we're going to be talking about applying a traction splint for a femur fracture. Our victim Kyle fell on the missed the caution wet floor sign and fell, and has a fracture in the mid shaft of his femur. The only reason we would use a traction splint is for a fracture in the middle of the femur. You don't want to use it if the injury involves the hip or the knee, joint above or joint below. We've already gone in, done a primary and secondary survey. I have consent to treat him, and as you can see, I and my partner Zach will be joining us shortly. Both have our BSI on. So we're going to go ahead and just proceed with the application of the splint. The first thing I'm going to do is have Zach come in and manually stabilize the fracture site above and below the injury. And we're going to get out the traction splint, and first thing we're going to do is go ahead and assess the leg. We know that our fracture is right about here in the middle. The other thing that I want to assess is the CMS in his foot to make sure that there's no compromise. So I'm going to go ahead and slide him out of his boot. Try not to hurt you as I wiggle you out of your boot. I'm going to loosen this one just so I can do a comparison of the CMS in both feet. Can you wiggle your toes for me? Good. Tell me what toe I'm touching.
Little one.
Good. Tell me what toe I'm touching.
Big one.
And then I'm going to check your pulse. Okay, so he has good CMS in both feet before we start the traction split application. With the Kendrick, it comes out of the bag and we have a couple different pieces. The first is your ankle hitch, which I'm just going to set here. The actual traction, the pole that we're going to use to pull traction, which we'll use here in a minute. And then stabilization Velcro straps. They are red, yellow, and green. The groin strap that we're going to go ahead and position first. And that one, you want to put that as high up onto the back bone that's at the back side, the ischium there. So I'm going to go ahead and slide this underneath the joint, underneath the knee where I've got a little bit of room, and just kind of work it up the leg. Until we get that positioned where we want it. And since the traction device is going to attach here on the outside of the hip, make sure that's right there on the outside of the hip. You should always warn your patient this is probably going to be pretty uncomfortable. You should be able to fit 2 fingers underneath each of the straps. How does it feel? Snug? Okay. And the positioning is good. So next I'm going to measure the length that I would like for my traction, and Kyle's pretty tall. So I think we will probably actually leave. We want to measure as well off the good leg, because assuming that he's got a femur fracture, his leg may be shorter than the other. So I'm just going to reach under Zach here, sorry Zach, and measure off the good leg, and there's plenty of room to pull some traction with that one length on my splint. So I'll go ahead and position that. And then I'm going to apply my ankle hitch. Padding goes toward the back. You should be able to get it under your victim's ankle without too much maneuvering, if any. should fit snugly around the ankle. And now I'm just attaching everything, I'm not pulling on anything. And so your ankle hitch connects to your traction pole right there. I'm not pulled any traction, I'm just assembling at this point. And then I'm going to put my Velcro straps in place. The green is the shortest, and again I'm going to do that little trick of sliding under the knee and then shimmying down to position my straps. You don't want these directly over a joint or directly over a fracture site, so I'm going to go above and below. I'm going to wait to secure those until the traction has been pulled. Okay, at this point I'm going to explain to my victim what I'm going to do next, which is start to pull traction using the traction splint. Hopefully what you're going to see is the leg return to more of an anatomical position, and hopefully a reduction in your victim's pain as you're pulling traction and separating that fracture. So I'm going to pull traction until my victim verbalizes some comfort. Is that any better?
A little bit.
Okay. So we've got our traction pulled here. With our traction device, we're going to go ahead and apply the stabilization device. Zach, you can go ahead and let go. And then, as with any splint, after you apply it, you want to recheck your victim's CMS. All right, wiggle your toes for me. Good. Check your pulses. Good. Tell me what toe I'm touching.
Big toe.
Okay. Tell me what toe I'm touching.
Big toe.
Okay. And then you would proceed with management of shock, treatment of any other injuries, and long spine board immobilization if it was needed for your patient.